thank you so much for inviting me here this afternoon. And it is just so brilliant to be here and to be celebrating. And celebrating not just the outcome, because we have preserved our health centre, but celebrating the campaign itself. Because, you know, I've been part, as a political activist, I've been part of many campaigns, working in the community, both over in Greater Manchester, wherever I walk, and over here. But I have to say that those campaigners that are in this room at the moment, and those who couldn't attend today, I've rarely seen a campaign so effective. Mm-hmm. I think it's been about, and I'm looking at, and I'm going to miss somebody's eye contact here, but I'm looking at the people in this room, and the campaign itself, right from the outset, it was that purpose of we're not going to let this happen. We're not going to let this happen because this is about people over profit. And, you know, the campaign, it's been about that commitment, it's been about that determination, but it's also been about really skilled people, for whatever background they come from, that have said, I can offer this, I can make this contribution, I can be part of this campaign, and this is what I'll do. And people coming together and communicating the message so effectively. I mean, your links with the and relationship with the media has been absolutely fantastic. And you know, so you know, first of all, absolutely amazing. And also, could I also say, Paul Wilding here, and I know it will be echoed through this meeting, that and Hester, I hope you don't mind me naming you as well, but you know, GPs, I've met quite, on my campaign before I was elected, I have met a number of GPs, and I'll talk more about that in a minute, who have, and it's the same with head teachers when you're in education, who have stuck their neck on the line, you know, their head on the line and their neck on the line and said, this must stop. You know, we are not accepting these cuts. This needs to change. This is about our patients. This is about their health care. This is about our community. But it's a big step, Paul. I know that. And you do feel it's a lonely place to be sometimes. And so, you know, I must acknowledge what you have done, Paul, Hester, what you've done, and other GPs. Fantastic outcome, and you know, praise due to everybody involved. And I really, really don't want to rain on the parade, but you felt it coming, didn't you? You felt it coming. One of the things I've done, actually not while I've been here, but over the last few weeks when I've been in Westminster, is to actually phone up some other GPs in the constituency. Because the success here is wonderful, we should celebrate, and let's take anything away from that. But the GPs I have been speaking to, one who I'm not going to name, but he actually said to me, we're just about keeping the lights on at our surgery. We're just about paying the bills. Another said, we are going to face job losses at our surgery, and we are volunteering to take pay cuts. Now, that is the truth of what's happening, not just in our constituency, but across this country. 40% of GP surgeries and health centres are taking cuts or facing closure. And I believe in Huddersfield, you'll correct me if I'm wrong, Paul, but 60% in Huddersfield itself are possibly facing cuts or closures. So, what I would say to you, those of you who have worked so hard, have a little rest, you deserve it. But what I would say to you is that the job is not finished. And you are the kind of people, campaigners are people who are self-sacrificing. Campaigners, it's just innate, it's in you to say, we cannot let this continue if you see injustice. And you deserve a bit of a break, having done a wonderful job. But what I would say to you is there's a lot of surgeries in this constituency and across the country that need people like you to support them with their campaign, because the job's not finished. And it's not finished for our doctor surgeries, but also you will be more than aware of what's happening to our threats to our HRI, our own infirmary, and the A&E. And I don't know whether I did speak on several occasions yesterday when this business plan, this full business case, was produced late, first of all, to add insult to injury, and because of commercially sensitive information, all the information wasn't in there. Well, of course it was late and it's commercially sensitive because it's about another PFI, it's about possible 500 job losses, and offering this area, Greater Huddersfield, 64 beds. 64 beds for over 250,000 people. It is shameful. It is shameful. And, you know, as a local person, at the moment, my mother-in-law, Rob's mum, is in HRI. She's been in there for a month. I hope you don't mind me sharing, Rob. But she's been in there for a month. She needs specialist care, and she would be called a bed blocker because they cannot find that specialist care. So it's what's happening in the community and care closer to home as well that is not working. And the more it's not working out in the community, the more pressure on our infirmary and our A&E. And so it is not acceptable at the moment, this plan. And I am proposing, and I'll be at the meeting next Friday, that we throw it out. You know, I agree transformation is needed, that STP transformation is needed, but local people have not been listened to. We do not, if there's an emergency, want to be trolling over to Calderdale. If we've got a loved one, as we have at the moment, we do not want, especially if you haven't got a car, to be going every day to visit over in Calderdale. It's not thinking about accessible, high-quality healthcare, which we deserve, and it's our right, not a privilege. So that is the other campaign. It's the GP surgeries. It's what we are entitled to as local people in our community. And I keep being got at, if you like, or asked the question about, you said in your campaign you would save A&E. Well, obviously, anybody with a brain will know that was about the Labour Party being elected and the Labour Party's commitment to halting all cuts and closures and to stop the STPs and to have a full health review to see what's fair and right and what is possible to deliver today in the changing society that we have and the aging profile, the age profile that we have in the aging population. So, you know, that the battle is on. I believe that this business plan, this full business case, should be thrown out. I think it certainly should be bounced back to Jeremy Hunt. On Monday, I have sorted out that the 4 Kirklees Labour MPs will meet with Jonathan Ashworth. We're meeting at Portcullis House, 5 o'clock on Monday afternoon. And hopefully all 4 of us are going to be there because we've all got our own campaigns for our own hospitals, you know, Paula and Tracy, Barry and myself. And we're going to meet with Jonathan Ashworth and we're going to discuss, you know, further plans, strategies for how, with activists like yourself, that we can get that message out there to say enough is enough. And campaigners I know for Hands Off HRI are coming together. They've worked so hard and I'm proud to be just a little part of both their campaign and Slathgate campaign to say you have raised loads of funds, you've worked really hard to mount, if needs be, a legal challenge against this. But, you know, I am hoping that in the House, because it's not just this area that's facing cuts and closures to the health service, it's across the country. And there's that general discontent amongst communities to say, you know, was it Walthamstow Hospital, Lewisham Hospital, where they did win. Campaigners, it was Heidi Alexander, wasn't it? You know, the campaigners, it worked. They were successful. It's worked here. Yeah. But it's worked here with our health centre, and we cannot let them do this to our hospital. And yes, the question was, well, the actual building itself, HRI, is falling down. Well, yeah, I can see that when I go around it. It might have a posh facade now and frontage, but actually you can see the building itself is obsolete. But it's not about a building, it's about people, it's about the staff. It's about how we pay them. It's about safe staffing. It's about bursaries for our nurses. It's all of that. And so we need to have a general review of healthcare provision and the way we treat our staff working in healthcare. All of those things are really, really important. So as I say, I've got this meeting on Monday. We want, it says in the report, you know, compassionate care. And I'm in the Examiner this morning, they quoted me on that. And this business case, this business plan is not about compassion. It's not about adequate care. It's about money. And at the end of the day, I was asked, you know, on Look North and on from a few other media people yesterday, but how are we going to afford it? You know, you get this question, how are we going to afford it? And it's interesting that on the two local TV programmes, it was cut out of both that I said, £1.5 billion for the DUP for 10 votes.
Yes.
£1.5 billion for 10 votes to get the laws through that they want, the Tories. And I'm sorry to be really political, but that's the truth of it. They could afford £1.5 billion to get 10 more votes. So they can afford, the magic money tree was there when it was needed. And so if you prioritise good quality healthcare, and as a former head teacher, I would say good quality education and funding for our schools, then if it is your priority, the money can be found and can be there. And that's the reality of it. So those of you who've been so successful with this campaign, take a breather, enjoy your success, well done. But also, when you've had that breather, will you keep on the fight for our infirmary and for our A&E, because we can do this. Thank you very much.